Unfortunately, essential tremors do not respond to medicine so well. Many of the elderly people have hypertension, diabetes, cardiac disease, so they are not fit for surgery.
Doctor, 20,000 surgeries, I think for those of us who don't come from a medical background, that number is, it's staggering.
The death rate was quite high. People didn't like neurosurgery at that time to deliver good service to the people who are dependent on you. Every day what we operate is something if you don't, they'll die. And we went ahead with surgery for 10 hours. The last 1 year we treated one teacher. He said they did not give a job because he cannot write on the blackboard.
Sound wave therapy for brain.
Fortunately, KIMS Hyderabad has the vision of investing in technology for the benefit of patient.
An average person who doesn't know why their hand is, having a slight tremor or, somebody who's going through this experience, what would be your message to everybody watching this?
Means people around you who have
Imagine this. You try to sip your morning coffee, but your hand won't stop shaking. You reach out to hug your child, but your arms are trembling. You're not able to write your own name. For millions of people, these simple acts are a daily struggle. Now imagine fixing it, not with surgery, not with a scar or an incision, but through sound. Interesting, right? That's exactly what we're going to explore today. To help us understand how this breakthrough works, we are joined by one of India's leading neurosurgeons, Dr. Kumar Panigrahi, Senior Consultant Neurosurgeon at KIMS Hospitals, Hyderabad. For joining us, sir.
Yeah, morning. Thanks for inviting.
Doctor, before we get into today's topic, the work you're doing is not just saving lives, but changing lives. And you've performed over 20,000 brain surgeries, including 1,000 aneurysm surgeries, 750 epilepsy procedures, and, even pioneered robotic and AI-assisted surgeries in India. Please tell us, what has been your driving force, to keep pushing the boundaries in neurosurgery in India?
It's not about only neurosurgery. If you want to excel in any profession, one has to have passion to excel in that subject and to deliver good service to the people who are dependent on you.
Doctor, 20,000 surgeries, I think for those of us who don't come from a medical background, that number is, it's staggering. We don't understand the sort of time and commitment, that goes into it. So, can you tell us, what is it like to be a neurosurgeon operating at that level?
See, neurosurgery is a little different from the other surgical specialities. In neurosurgery, the margin of error is very less because neurons, once damaged, they don't regrow. So unless somebody has an interest, because it's a long-term process to learn, give precise outcome, it is not easy. But then I got interested because where I did my training, there was no neurosurgery in our hospital, a medical college. So I thought we can develop neurosurgery in our center. And the place where I joined, Nimans, Bangalore, the first day I joined in the ICU, 3 patients died. People didn't like neurosurgery at that time because the death rate was quite high. And when 3 patients died, one of my consultants asked whether you will continue that subject or leave it. I was confused, but he said you have to continue because there are a lot of things you can develop. You can reduce the death rate by working more, But other specialties already established, plateaued out. You cannot do anything. So you have to continue neurosurgery.
That's very thoughtful, doctor. The fact that you saw the number and that became a motivation factor instead of like a demotivation. And like you said, you're working on the most sensitive parts, I mean, of the body, right? The brain and the spine. But even in that sensitive zone, you've had groundbreaking procedures. India's first AR and AI assisted brain tumor surgery, even the frameless DBS, robotic DBS for Parkinson's. What goes through your mind, when you before you take that decision to integrate technology into neurosurgery, before you take that decision that, hey, this is a new tech that I'm willing to try, or that's a new tech that I'm willing to bring to India?
Whenever I go for any meetings, I like to attend a lot of non-medical meetings also, and then always think how the engineering technology can be helpful for neurosurgery. And in neurosurgery, it is technology driven. The outcome of neurosurgery has improved because it's technology driven. When technology is there, it's quite expensive, and a lot of infrastructure is required, a lot of space occupying equipment is required. Then it is difficult to translate to the peripheries of the country. We try to adopt AI and AR of thinking how to reduce the size of the equipment so that it can be more mobility is easier, and one can then have less cost on infrastructure. Then it can be moved to different places, and if it's cost effective, then it can be used at different parts of the country in the district places. That is what we need in countries like us.
Interesting. That accessibility and mobility factor,
Yes.
Not something that we often think about from the perspective of a non-medical person. Doctor, I know that 20,000 is a lot of surgeries, and you see way more patients apart from surgery as well. But has there ever been a story or a case that has stayed with you, something that you will always remember? Either it was a success story, or it was something that made you feel like, I wish there was more technology that, could have helped the patient.
20 years ago, I used to think like that, but now it's not so.
Yeah.
And when 20 years ago, like tumors in the base of the brain, skull-based tumors, was told as no man's land. People used to leave them, let them die, or because the complications with surgery was so higher that we used to explain that better don't go for surgery. But now with navigation, laser, and ultrasonic aspirators and gamma knife, so we have treatment where we can give life to patients by operating, and surgeries can be done without operating also with the gamma knife.
Beautiful. Any story from 20 years back where any patient you remember where you thought, this is a case that I wish I really could operate on? Of course, now you said things are different. Any story that you might have for us?
Every day what we operate is something, if you don't treat them,
Of course.
they'll die.
Yeah.
But then one case I remember, when patient had was refuse surgery everywhere. One 70-year-old gentleman, and then he had a tumor at the foramen magnum, at the junction of the brain and the spinal cord, and he was not able to walk. And this patient we took for surgery. When he was anesthetized, patient had an heart attack because he's elderly, he had hypertension, he has diabetes. Normally, before start anesthesia, when there's a heart attack, we try to avoid continuing the surgery. But then we discussed with the patient that we have two choices: either come out or go ahead with surgery. They understood the gravity of situation, and they were with us. This is the only chance for him. So they accepted that whatever happens, you go ahead with surgery. And we went ahead with surgery for 10 hours. And that patient went home 10 days later walking. And then he survived 10 more years.
What is something that you think is going to be the next big thing, in neurosurgery or surgery in general, that you have probably heard in recent times?
See, many of our patients which we operate, they are elderly, and with increasing longevity in our country and all over the world, many of the elderly people have hypertension, diabetes, cardiac disease. So they are not fit for surgery, and their anesthesia risk becomes higher. And so that's why we have to think of treatment which can be done without surgery. That is the reason we are looking for technologies like focused ultrasound or gamma knife, where treatment can be done without opening with the same precision.
Doctor, it's very interesting to hear of all these things, that are going to be a possibility in the future or, are being tested, researched right now. This brings us to a problem that millions of people suffer, every day on a day-to-day basis. And it's a slight tremor. That's what they think at first, right? They might see a tremor in their own hand, or a lot of us sometimes see it in our parents', hands. It can get a little frustrating that we're not able to hold something, we're not able to write something, right? But what does that slight tremor actually mean?
People think it's age-related, don't give importance, but these are called essential tremor.
Right.
Means it doesn't bother you in your day-to-day work. But then for fine work, when you're eating, when you're taking your food, you can it spills over. If you're taking coffee, tea, or it spills over. So then people were very embarrassed, then go to weddings, for functions, because they don't want food to be spilling over and all those. So that tremor is called essential tremor, and plus tremors can happen in Parkinson's disease also.
Okay.
Yeah.
When does somebody know that, okay, this is a serious problem? Now is the time to, consult with a doctor.
No, it happens in old age, but doesn't mean it's an age-related problem. It's called essential tremor. Very few people can have it at a younger age also, at 30, 40 years. So they are genetic. But people who have at elderly age, it's called essential tremor. This can be treated. So they have to consult a doctor, and normally they first treat with some medical management. And if it does not respond to medicine, then there are alternative treatments for that.
Doctor, you mentioned that there is an essential tumor and you mentioned that there's Parkinson's also. So how would a normal person differentiate between the two?
Yeah, there are two types of tremor. One is tremor, well, people have it only while doing their work. That's called essential tremor. But many people at that age have Parkinson's disease also. In Parkinson's, usually they have a stiffness of legs and hands, and they have difficulty in walking fast. They have slowness of their movement, and then they can have tremors also. So, and many of the Parkinson's patients can have only tremor as a dominant factor over stiffness and slowness. But there's a lot of difference between a tremor due to Parkinson's and essential tremor. In a Parkinson's, the tremor happens even at rest. Somebody is sitting, like I'm sitting like this, and the Parkinson tremor, the hand keeps on moving or at rest. Whereas in essential tremor, it happens only when they're doing some job. Suppose they're having coffee, tea, then it spills over.
Pins.
So in Parkinson's, it happens at rest and doing work both.
And you mentioned that it might not always be age-related. It could also be genetic. Could you explain that a little bit?
Yeah, few of the Parkinson's and essential tremor, they are genetically driven, and then if it runs in families, and if it runs in family, then they can start at an earlier age. Sometimes they're detected at 30 years and 40 years. And normally we treat them with medicines. They do not work for lifetime. After 5 and 10 years, the medicines get adapted to the body. Some of them develop side effects of the medicines also.
Okay.
So that is the time when one has to think of alternative treatments.
Doctor, for somebody who is living with this, tremor, especially like you said at a younger age, in their 30s or their 40s or even in their older ages, how does their life change? How does their day-to-day change? And what's the impact on the mental or the emotional state?
Somebody at 30 years having a tremor, nobody likes to marry them, starts with social, marital, and nobody gives them a job.
Yeah.
Like in the last 1 year, we treated one teacher. He said they did not give a job because he cannot write on the blackboard because of the tremors. Now I have a dental surgeon. They said he cannot do dental work because he has tremors. She has tremors. So that they don't get a job. People socialize. The marital life is affected, and their income is affected. And if they are the earning members, then the whole changes the lives style of
Entire
the
family is
person. Family is
affected by it. Yeah.
Unfortunately, essential tremors do not respond to medicine so well. And when we treat them, they are the most grateful patients to the doctors because it changes their whole lifestyle.
Life again, yeah. What about, when it happens at an older age, when it happens with an age, related factor, how does it change the patient's life? When
I
you
think
cross,
both age groups, they're grateful when they have the treatment
right,
because
right.
in younger people are dependent on them, so they become independent after treatment.
Again, yeah.
And unfortunately, in elderly, though in our culture we think all elderly should be taken care, but in the present situation, many elderly are left alone,
Right.
and so nobody is there to take care of them.
Mm-hmm.
And if they have a tremor, they cannot feed themselves, they cannot take a coffee, and they cannot go outside.
Yeah.
And once the tremor is controlled, then they can be independent. And so that is what, whether it's young or old, change in their lifestyle of the
Good
person.
impact
Yeah.
on their life. Yeah. I think one challenge that, probably comes for patients with tremors is what next? How long will this sustain, or what will my future look like? Is that a fear that you see among your patients often? I'm guessing especially those, in their 30s or 40s. Are they often scared about what will the future look like?
Yeah, 30, 40, sometimes they feel that the tremor can come back. And so even if we do treatment, 70% of them, they do well, but 30% they can come back after 5 years. They are apprehensive that if it comes back again, it may be difficult for them to earn. But then fortunately, these treatments can be repeated, and then they can still have another span of a good life.
Got it. Let's say, doctor, it starts with a slight tremor, right? Occasionally, not very often, occasionally not coming in the way of their life. Is it guaranteed that it will get worse with time if untreated?
See, all of them do not behave the same way. Some people, it can remain at one stage for their life without increasing any further.
Okay.
But 80% of them, they progress with age. And so that is why that has to be treated.
You mentioned, doctor, that there is a treatment, especially when it's a slight tremor or in the initial stages. So what does this medication look like, doctor, and how does it work?
Yeah, for essential tremor, we give like beta blockers and all those. And if it doesn't work, then you have to go for deep brain stimulation or focused ultrasound. But for tremor dominant Parkinson's, we usually start on Syndopa. That's the commonest medicine. Actually, Syndopa was developed just 50 years ago, not very old. Before that, we used to do surgery, was the only treatment available. But after Syndopa came, people started using medicines. When doctors thought that it is the panacea, but it was not so. Because Syndopa also worked for 5 years, 10 years. After that, it stopped working because body gets adapted to the medicine. So the medicines don't work. So after 5-10 years, they need to go for alternative treatment like deep brain stimulation or focused ultrasound.
Got it.
And also, Syndopa has side effects. By taking the medicine, though stiffness and tremor might come down, but that they can have dancing movements. And usually we start with a low dose. Maximum we can go till 5 or 6 tablets per day. Remember the rule of 5, that if you are taking 5 tablets a day, look for alternative treatment.
So if we can take 2 steps back and look at, let's say a patient has come to you for the first time, right? What are the treatment options or the treatment route that you recommend to a patient? And like you said, after a certain point, we do have to look for, alternative therapy. So when does that stage set in?
Yeah, in addition to medicines, we ask them to change lifestyle and do some physical activity, go to physiotherapy, because whenever there is stiffness, then they can have joint problems and osteoarthritis and all that. So to prevent that, they need to do regular physio and do limb strengthening exercises and maintain healthy lifestyle.
Right.
And we ask them to be under regular follow-up. Normally for 4 to 5 years, we keep on suggesting medicines. So after 5 years, then we suggest them to go for surgery. But some of the Parkinson's can be confused with other Parkinson-like symptoms. It's called Parkinson plus. those patients do not respond to medicine.
These medicines.
So whenever we suspect by examination of the patient that it is not a classical Parkinson's, then we ask them to do a MRI scan, do a PET scan to differentiate whether it's a classical Parkinson or a Parkinson plus. Some people don't like to take medicines every day 4-5 times. So when we do focused ultrasound or DBS, the medicine dose can be halved. But normally we suggest surgery after 4 or 5 years of medical management, because after 4 or 5 years, they start showing the side effect of that drug.
Okay. Under what condition, when do you feel like, one you mentioned was, when the medicines stop, reacting in the right manner or the side effects start showing. Other than that, you mentioned the, Parkinson's plus. Is there any third reason why you would recommend surgery to somebody or any alternative therapy to somebody?
The time period of the effectiveness of the medicines working comes down. There will be a lot of fluctuations.
Understood.
You can have suddenly it works for 15 minutes only and then it doesn't work. So whenever there's fluctuations in the clinical effect, then
that's
also
when you know
we
it's time
suggest
to
surgery.
Got it. Now you mentioned Dr. DBS and focused ultrasound. Can you explain to us what is DBS?
DBS, the full form is called deep brain stimulation. Parkinson's is due to deficiency of dopamine, as I told. And in the brain works in electrical circuits. The chemicals produce electrical current, and then that's how the electrical current transmits the impulse from one part of the brain to the other part of the brain. So whenever there is a deficiency of dopamine, the transmission of electrical impulse is affected. So to replace that, we give dopamine, and when the dopamine doesn't act, then we give electrical stimulation. That is called deep brain stimulation. For that, we have to make a hole on the skull on either side and then place an electrode in the central part of the brain, and that electrode is connected to a pacemaker which is left under the skin, and that pacemaker can be controlled from outside.
And like you said, there'll be a cut and an incision.
Yeah, because it's done and you have to make a hole and when you place an electrode in the brain, there's potential chances of complications or bleeding and infection. So it is safe 95 to 97%, but 2 to 3% risk will be there.
There is a chance. Yeah. That's very fascinating. But I think what's going to be even more fascinating is talking about focused ultrasound, which is also, an important topic for today. You mentioned focused ultrasound, but I would love to know, understand it better.
A focused ultrasound is something, it works like on sound waves.
Okay.
Yeah, it's like sound wave therapy for brain lesions.
I think we have to take a minute to digest, what you just said. Sound wave therapy for brain. That's extremely fascinating, doctor. Please tell us more about it.
Yeah, sound wave means sound wave is an energy like any other, like a light energy. Sound also is an energy. All these days, sound is taken that it is used only for listening, and in submarine, I know means everybody we are taught in school that is by the reflection of the sound wave, you know what distant is.
The object is.
But people who are in hotel industry, they'll know that the sound waves are used for tendinizing. The meat in the hotel is always softer than what we do at home because they use ultrasound to tendinize that. So this power of tendinizing or making it softening of the sound was taken by medical scientists to use it for brain, to make certain parts of the brain which are diseased. If you tendinize or make it softer or make a lesion in that, it can produce good effect. If it's a brain tumor, you can tendinize that. But then 70 years ago, people used sound waves for brain tumors and for Parkinson, like they used to cause lesion in the subthalamic nucleus or globus pallidus. But then they had to again make an opening on the skull because sound wave does not cross bone or cannot cross any wall like that.
Right. Any thick anything that is hard or
it
thick,
only can go through water or go through air. So and then it was approved only in 2016 by FDA. So this technology, when we saw that is working, and we had a lot of patients of DBS who were so apprehensive of surgery, who did not want to accept the 2-3% complication of DBS, and who are not fit for surgery because of blood thinners, anticoagulants, or hypertension, diabetics, heart disease. And we wanted to offer treatment for them. So that is why we adopted this technology.
From what we understand, it's MRGFUS. So if you can tell us a little bit about that procedure, doctor.
Is magnetic resonance guided focused ultrasound, or MR guided focused ultrasound. Here we don't do it in the operation theater.
Okay.
Usually we fix a head frame, and then patient is put on the MRI scanner,
Okay.
and then localize the specific area which is responsible for the disease. And we use different softwares to identify that area, and then first do a trial lesion, like with a low temperature, where we focused ultrasound, we increase the temperature to normal body temperature, like 34, 37, 40 degrees centigrade, which is normal body temperature is 37.4, and see that does not cause any side effect to the patient.
Okay.
And then we increase to 50-52 degrees. In 52 degrees centigrade, it is reversible lesion at the brain. Then we go and test with the patient, because patient will be talking, is not under anesthesia. We go and ask the patient, check for whether the tremors have come down or not, whether the stiffness or the rigidity has reduced or not. And once you are confirmed that the tremor has come down, then at that point we increase the temperature to 58 to 60 degrees. So that will give a permanent scar there, which will have an effect for more than 5 years. They come with a tremor to the MRI room, and the procedure takes usually 1 to 2 hours. And when they come out of the MRI room, the tremor is gone. So that is what means. It's an excitement for the patient relatives when they see. We had one patient who was 65 years. When the patient came out, and so when he wrote his name, he was not able to write his name for many years. So wife was so happy that husband could write his name and sign, because he said he could not sign check for so many years. So that was the excitement the wife had. And then all this without any surgery. They come to the hospital in the morning, they go in the evening. They come with the tremor, they go without a tremor.
Extremely impressive, doctor. So between DBS and MRFUS, how do you differentiate which is better suited for which case? And both the procedures are available at KIMS, and both the procedures are something that you have practiced and you're familiar with. So how do you help patients also make the right decision that this is better suited for you and that is better suited for you?
We always discuss with the patient that what is best for him. It depends. If he has disease on both sides, we suggest them that you should have DBS if you are fit for surgery. And if you are afraid of surgery, we can do focused ultrasound. But if you have unilateral disease and you are not fit for surgery, and then many people who are from other countries, many people are from other states, then they cannot come from repeated follow-up. When you do a deep brain stimulation, it works on a pacemaker, and the pacemaker needs repeated programming. You have to change the current strength, the frequency, the duration. Some people do not want to come for repeated. They're difficult for coming for repeated programming. So those patients, we tell them better go for focused ultrasound. So we sit with the patient, discuss pros and cons of both the procedures, and then combinedly we make a decision what will be the best for his disease, and looking at his logistics of follow-up also. And over these years, what we have seen is 75% do not undergo. They don't want to take the risk of surgery. Over these years, we realized that we are not offering treatment to this 70-75% group of patients. And that is why we came across this technology. We adopted the technology to pass on the benefit to the patients. The aim is to offer treatment to all patients.
And when families realize that this is not going towards DBS, it's not a full surgery, it's a focused ultrasound, how do they normally react? What have your patients reacted like?
Actually, families they have more knowledge than us. So after explaining everything, they tell us, doctor, we know everything. We have come for focused ultrasound. You do focused ultrasound. Means psychologically, a human being, we don't want anything in season.
Yeah. And are they usually relieved when they figure out that, we can go for a focused ultrasound?
Yes, yes. So that is one advantage, because focused ultrasound can be followed by a DBS.
Right.
Whereas DBS following with focused ultrasound needs another surgery of removing the whole DBS and then doing a focused ultrasound.
Understood. Doctor, you were also mentioning that focused ultrasound might find uses in other, medical conditions as well. So can you throw some light on that?
Yeah, focused ultrasound at present has been approved for essential tremor and tremor dominant Parkinson's.
Right.
But what clinical trials and papers have already come is on epilepsy and seizures which are not controlled by medication. So now for epilepsy, again, we do surgeries. We open and do removal of surgeries of the focus, the epileptic focus. But in focused ultrasound, without any surgery, you can destroy the focus. And for it is also being under trial for brain tumors, small brain tumors. And then trials are undergoing for opening the blood-brain barrier.
Okay.
Normally, whenever chemotherapy is given, the brain has a blood-brain barrier. The chemotherapy drugs do not enter the brain. So focused ultrasound is used to open up the blood-brain so that when chemotherapy is given, it can enter the brain and work on the brain tumors. So tumors which cannot be operated, you can give chemotherapy. And also the focused ultrasound has been used for psychiatric diseases like obsessive compulsive disorder, for depression, and also for chronic pain. So that's the future. That means chronic pain is increasing day by day. Psychiatric diseases also are increasing day by day. And though DBS was suggested for all these diseases because it was an surgery, invasive, nobody was accepting. But now, if these diseases are now established as a treatment protocol, focused ultrasound has a great future.
But I'm sure with more and more development and more news and conversation, negativity and myths and misunderstandings also increase equally, right? So I have a few myths that we've observed about the focused ultrasound procedure, and we'd love for you to bust these for us. Is the MRFUS same? Does it count as a brain surgery?
It is not a brain surgery because it is done in the MRA room, and there is no opening, no incision. There is no general anesthesia. So it is not considered as a brain surgery.
Understood. It is considered painful as well?
No, it is not painful. The only thing which causes pain is putting the frame. But while putting the frame, the pin sites, we give some local anesthetic. And during the procedure, when the ultrasound waves goes to the brain, there can be a temporary increase in the temperature. So sometimes they feel some warmth inside while during the treatment. But they do not complain. It's not uncomfortable for them.
There's also another myth that older patients might not be able to undergo, focused ultrasound. It might not be safe for them.
It is actually totally wrong. It's the older patients who are not fit for surgery. They can undergo this. So most of the patients all over the world who are undergone, they are actually elderly.
Understood.
Yeah.
And the last myth that we've heard, doctor, is that it's a very widely available or easily available procedure. Is that correct?
It is not easily available. It's a very expensive technology, and nobody agrees. Fortunately, KIMS Hyderabad has the vision of investing in technology for the benefit of patient, and we are the first center in Southeast Asia. At KIMS Secunderabad, Minister Road, we have installed a 3 Tesla MRI with focused ultrasound, and we are almost on the verge of finishing 50 cases.
It, like you said, it really takes a vision to be able to, put together the resources and the, equipment and everything else. And I think as people in Hyderabad, we're really lucky that we have this treatment available to us, you know, very easily and, you know, right in our city. Doctor, before we, you know, wrap up, of course, it's been a pleasure talking to you. But before we wrap up, is there one message that you'd like to leave everybody watching with? You know, it could be your students, it could be young doctors, other medical professionals, or, you know, an average person who doesn't know why their hand is, you know, having a slight tremor, or, you know, somebody who's going through this experience. What would be your message to everybody watching this?
Means people around you who have tremors, whether it is essential tremor or Parkinson's, ask them to at least consult a doctor, and then they have to be treated first with medicines, and if the medicines do not work, send them to the specialist, neurophysician, and we are always available at KIMS Secunderabad to have a consultation whether alternative therapies like deep brain stimulation or MR guided focus ultrasound can be done. Vision of KIMS Hospital has been to get the expensive technology at an affordable price to this part of the world. And it's not only in neuroscience, the concept is extended to all departments, that patients need not go to out of the country for getting the best treatment what is available in other parts of the globe.
Thank you, doctor. Thank you so much for making the time to talk to us and enlighten us about this procedure, about the situation, about the condition. Like I said, for people like me who don't come from a medical background, this is an eye-opening conversation. And I'm very glad that we could have it with the stalwart, you know, with the most well-known person and the, you know, most trusted doctor in all of India. Thank you so much for making the time to talk to us.
Thanks for inviting to the studio.
If you or someone you love is experiencing tremors, don't hesitate. Please reach out. MRGFUS at KIMS can help you do the little things again. Hold a cup, write your name, or hug a loved one without any fear. To learn more about MR-guided focused ultrasound for tremors, reach out to the KIMS Hospital Institute of Neurosciences. The details are in the description below. That's it for today's episode of Your Health Matters podcast. Until next time, stay safe, stay healthy, and stay curious.